Patient today is Sarah, who's a 2-year-old female min-pin mix for an ovariectomy. She's from a rescue called Friends of Homeless Animals. Coming into the OR, I have a bear hugger set out. For any additional heat support, I also have various flushes, a sharps container, emergency drugs, any venipuncture supplies, and additional heat warming socks. My anesthetic machine is plugged into oxygen and scavenge. All the leads are rolled out. I have enough isoflurane. My oxygen tubes are hooked up appropriately. I have SpO2, EKG, blood pressure, as well as an esophageal thermometer, all set out. Capnography as well. And a warm water blanket with a thin sheet over top. I have surgical light handles, sterile, so that the surgeon can move them as they please. I have a soft tissue pack, table drapes, and the appropriate scalpel and suture that the doctor requested. Here I have my IV fluid supplies, LRS, drop set, and extension set to be properly primed. Here I have a surgical mask, proper sized gloves, and a gown set out for my surgeon who likes to open them herself. Also, I've made sure there is enough Avogard for her to scrub in. My prep station is set up with extra blankets for heat, pre-oxygenation, catheter tape, antiseptic scrubs, catheter, T-set flushes, pre-medications, and induction, ET tubes, laryngoscope. Here I'm about to clip my patient for surgery. The clippers have been checked for cleanliness, and the blades are in good shape. I have my scrub supplies set out, which is chlorhexidine followed by alcohol. I gently clip a generous region up to the xiphoid process and then laterally, keeping the clippers parallel with the skin so I don't cause any abrasions. And I carefully clip the surgical site. I pull the skin taut as I run the clipper blades over so I don't catch the skin in the clipper blades and cause abrasions or cuts. Because the patient is from a rescue, there is some question as to whether she's been spayed before. She's at least 2 years old. It's an estimate. So the doctor's checking for any surgical scars or any evidence that she's been spayed. but decides that there's no surgical scars or anything like that. So we're going to go ahead with the procedure. So now I've begun my pre-surgical scrub using the outward circular motion of chlorhexidine and alcohol. Because she is a shelter dog, she was pretty dirty, so I did it 4 times each. Here now the patient has been induced and we're in the OR, and I'm using rope to secure all 4 limbs to the surgical table so that she's secure but not in any sort of extreme uncomfortable position. Then once I'm done, I cover her up with any part of her up that's not exposed for surgery with a warm fleece blanket for heat support. The surgeon is now in her gown, so I carefully secure her gown without touching any of the front part because it is considered sterile. And I tie her in. So she can go glove. Now back to my patient. I'm using the surgical scrub to again do an outward circular motion. And I use chlorhexidine followed with alcohol at least 4 times. Again, I'm still covering the patient, any area that I can that's not the surgical area, with fleece blankets. She's on top of a warm water blanket, and I have the bear hugger in case that I need it. Now my surgeon comes in with her gloves on. So I help her with her outside tie of her gown. Move her surgical table into position. And first I'll start with her table drape. So once I've removed the outer packaging, I remove the first drape so she can take it sterilely and drape her table. And I help her with the very, very out corners of it. Next, I open her soft tissue pack. It is double draped, so I open up the first drape and hand her the sterile inner drape so she can open it up sterilely. Next, I have her light handles for the surgical lights. She doesn't need the handle covers. We usually lay those out for extra long surgeries. Now I'm opening her suture and just dumping it on her sterile field without completely reaching over the sterile field. Both suture packs and then her scalpel. And because she has the light handles, she can move her lights how she pleases. The surgery progresses and finishes, and now it's my job to take out all the trash, dispose of all the sharps, move all of the instruments and surgical equipment into the what we call pack and scrub area. I've disinfected all the surfaces with Kenalsol. As you can see, it's nice and clean. Anesthetic machine, all the leads have been wiped down and wrapped up in preparation for the next surgery. Everything has been put away. Everything is wiped down. Floors have been vacuumed and mopped. The anesthetic machine is set back for the next patient. All reservoir bags are off. Leads are coiled up. And I'm disconnecting it from the scavenge and the oxygen for the next day's surgeries. Now I will move into pack and scrub, where the surgical instruments have been soaking in distilled water mixed with instrument cleaner. There they will be scrubbed and then rinsed and then put into this ultrasonic cleaner. And I will set the timer down here for 15 minutes. From there, they will be rinsed, dried, and then milked with instrument milk. Then they will sit for 5 more minutes and then wiped down. My instruments have been dried, milked, ready to pack. So I have my bin that they go in. I always place a clean paper towel in the bottom for them to sit on. We don't have a very specific way of packing our soft tissue packs. So we usually put the forceps, the spay hook, scalpel blade, anything without a handle, I'll just kind of put to the side. And then I will start picking up all the instruments in categories. So I'll pick up the scissors first, then the needle holders, then the hemostats. I'll put the curved with the curved, then the mosquito hemostats, and just kind of put them in order of what they are. Once I have them all together, I'll kind of lay them neatly out into the pack. Then I'll take my towel clamps, because that's always what they grab first. And put them neatly in the bottom. Next, I'll put some gauze. We don't count the gauze, we just kind of estimate the stacks. Now I'll take my indicator strip and put it kind of halfway through the gauze. That's a steam autoclave indicator strip. We also put patient drapes, disposable patient drapes, into all of our packs. And I've found here that I've folded it too wide for the pack, so I'm going to refold it. Accordion style. Now it fits into my pack, and I'm going to use 2 drapes. And I'm keeping in mind that the tighter the drape fold, the better it will be able to be sterilized. Each fold is also pointing towards the way that the sterile assistant or the non-sterile assistant should pull it out when they're opening the pack. Now that the pack has been wrapped appropriately, I'm first going to take some tape, steam autoclave indicator tape, put it on the front, and then take some regular masking tape, and I'm going to write the name of the pack, my initials, and the date that it's going to be autoclaved onto the tape. Packing the steam autoclave, the distilled water is up to the green point as it should be, and if I need more, it's right here, and I put it in this section here. So I'm thinking I can fit about 3 trays in here, one with the big pack. The manual said to face the view pouches face up. I'm used to them face down, but this is a new autoclave, so I'm going to put them face up. I'm trying to make sure that they don't touch the top or the sides of the autoclave, that they're just in the trays. I have some other surgical things like sterile gauze, laceration pack, quarter towel drape pack with towel clamps. Just trying to find the best efficient way I can pack the autoclave. Now that everything's in the autoclave appropriately, I secure the door shut, choosing the packs button since there's a pack in there, and hitting start.